An important part of unlocking potential and igniting minds is supporting the mental and behavioral health needs of our students. Today, we are excited to be here with our partners from Children's Mercy and Blue Cross and Blue Shield of Kansas City to announce an exciting new initiative to leverage their skills and resources to help us support our scholars.
I'm excited to say that this is a first of its kind, community-driven partnership between three organizations. And in working together, we address the mental and behavioral health needs of our children and teens. And it's designed to improve access to behavioral health education and services in the school setting. As you know, the nation's youth are facing an unprecedented mental health crisis, and our children and teens are greatly underserved. More than 15 million children need mental health services, and many do not receive the care they need. In the Kansas City region, 40 to 50% of youth go untreated. Facilitating early intervention is one of the 4 strategic pillars of Illuminate, which is what we call at Children's Mercy the initiatives that we're putting forth around mental and behavioral health.
Blue KC is committed to not only supporting the Kansas City community, but whole person health. And when we look at whole person health, we think of mental and behavioral health along with physical and treating the whole person. We are so excited to start to partner with Children's Mercy on this new initiative and the support that we can provide to support the Center School District to see how we can help with early intervention and support making change happen for adolescent and youth in this community. So thank you for letting us be a part of that, and we are excited to get started.
My first question for you is going to be, what shifts are you hoping to see in the behavior in the Center District after this program?
Increased behaviors, improved behaviors for students, but also providing our staff the tools and strategies that they need to address behaviors as they arise.
So when we talk about crisis or management, like how are we extending ourselves as adults to our students to speak and have real conversations about like resolution and get into resolution.
And so through this partnership, all staff will have an opportunity to receive restorative practices training. And so what does that mean? It's another option of discipline. And so typically, in Center School District, we have levels to discipline where you could get in-school suspension, a call home, out-of-school suspension. With restorative practices, it provides an opportunity for all students and staff to work through the issue. Like, how did you wrong the other student? And how do you make it right?
Reggie and I are former classroom teachers, and so we taught at Southeast High School and Kansas City Public Schools, and then we did this work in KCPS. So we know it works. We know that when we give students more voice and when we equal the playing field between students and teachers, so it doesn't feel like teachers are on one side and students are on the other, when we start working together, it creates a community where people want to be there. So number one, it's like, I want to come to school. Teachers want to come to school. That matters. We want both parties to want to be here. And then when crisis occurs, we're acknowledging it as a community, and we're not acknowledging rules. We're acknowledging relationships.
It's not easy being a part of a pilot program. You don't really know what's going to happen. You don't know if the reward is going to outweigh the risk. And so what was Center envisioning when taking on being the first people to engage in this partnership with Blue Cross and Blue Shield and Children's Mercy? Why Center first?
Good question.
Oh, wow. Great question.
So for me, the reputation of both of those organizations precedes the partnership.
There are a couple of really key components in partnership. One is you've got to have really strong leadership, and Dr. Cargile is awesome.
And so I've heard firsthand about the wonderful work that Children's Mercy does and Blue KC in our community. And so when they came to us and wanting to just have a conversation about the needs in Center and how could they partner, we were able to tell them things that we needed, and then they crafted the partnership to meet our needs.
The other thing is that the Center School District is of a size that allows us to really help the entire school district. There are school districts that are far larger that make it harder to make an impact. We're hoping that we can expand into those, but Center was the perfect place to start.
At the end of these 3 years, because this is a 3-year program, what does Center's behavioral program look like? Like, what's our end goal here?
Yeah. Well, I think, we look at this in a 3-year process. And the first part is trying to get early intervention, get awareness, help with restorative education, and help not only get awareness, but help reduce the stigma and get some of our youth and adolescents comfortable getting to have more self-awareness and introspection of the help or support they may need, and being able to help navigate that throughout the school system and have support from teachers, counselors, and in the community to help support them to have better health.
But I was wondering how this program is going to look for teachers and this type of support they will be receiving. Excuse me.
Right. So our plan and with Restore Ed and Center District, we're going to be working with all of the administration, support staff, and teachers on restorative practices. So, like, what does these practices look like in their own spaces?
Perfectly. Our whole idea is just like practical skills you can implement tomorrow, and not just this theory that we talk about but don't give you actual skills. And so it gives teachers skills, and then teachers give those same skills to students, and so that everyone is communicating in a way where they get what they need, and they're not just getting trapped in this cycle of frustration.
So our district is primarily composed of Black and Brown students. So I was sort of wondering how this initiative plans to accommodate the discrepancies we see in mental health awareness for students of color.
Yeah, so you bring out a really good point, and there is a significant discrepancy for those of color, particularly in the mental and behavioral health space. That is another reason why Center School District was such a great partner, is that we can learn from each other on how best to implement those things that we know from studies can be helpful, but when you actually implement it, particularly in specific populations, what we need to do to make sure that we optimize that to the best degree.